What is an effective healing modality that is used worldwide? Do you know? Think about that for a second. Do you know what the second most widely used medicine in the world is? Think about that for a minute. Think about all the different medicines that you know about. What's used the most?
Welcome to the Angelscapes podcast, where you're encouraged to uncover and develop a direct connection with your soul's power, wisdom, and spiritual intuition that is ready to blossom. We'll explore new ideas, compelling tips, and real steps to help you learn simple spiritual practices. We're a safe place to learn more about accessing your soul's power with education and spiritual wholeness that could bring more clarity to your life. Now here's your host, a practicing medium, Akashic Records practitioner, spirit artist, coach, and mentor, Dr. Reverend Nancy Smith.
So this is Angelscapes podcast, and I'm your host, Nancy Smith, and joining me tonight is Susan Keefe. She's a trained homeopath. She's a certified homeopath. It's called Certification for Classical Homeopathy, and she's going to explain what homeopathy is, how it works, and how you use it. And homeopathy embraces the mental, physical, emotional, and spiritual aspects of the patient when you're treating them homeopathically for whatever their ailments are. So not only is the patient health restored, also their well-being is restored. And this is the only modality that I know actually does this. And so I want to tell you a little bit about Susan's training. She first started out in pre-med, where she had to do all of the anatomy, physiology 1 and 2, and pathophysiology. And then after she completed this professional program, she went into the clinical program, and she went from there to teleosis homeopathic collaboration in Cambridge, Massachusetts. So she's medically trained, a lot of science behind her, and all of her skills and the things she does with homeopathy. So she has a bachelor's of science from um, University of Massachusetts in Amherst. She's just the smartest gal ever, but she has been involved in homeopathy for many, many years. So that's why I love having her on as a guest. It's been way too long, Susan, since you've been here. Thanks for coming on.
Oh, it has been too long. It's nice to see you.
Yeah. Nice. Yeah, my gosh. And I love homeopathy. I studied it for 2 years myself and did not follow it because my path took me somewhere else, but I used it with my children. And it was somebody had told me about homeopathy when my daughter, my baby girl, kept having ear infections, and they kept giving her that pink medicine, and then it would come back after she'd get off the pink medicine for weeks, and it would come back, and so my friends helped me. She was a homeopathist, and she was actually kind of sort of, I know about homeopathy, let me tell you a little bit. And I got some books and read it, and figured out that my daughter needed pulsatilla. And when I
Mm.
started giving her pulsatilla, the ear infections were less and less. I also learned how to look in her ears with the ear scope. I don't know if you're supposed to do that. So I could tell.
Absolutely.
So I could tell what she was fussing over, and I could get that pulsatilla in her before the ear infection came on, because there were emotional and physical things that she would do just before she had her ear infection. So we got her on that pulsatilla, and if I missed it, I could see that I missed it, and then I took her to the doctors. But we had less and less of that pink medicine, which is a nightmare for anybody who used that, antibiotic that was had in the beautiful little pink sweet sauce. After about a week of it, they would be out of their minds, ripping the house apart, because
Yeah.
they didn't do well on that. So having said that whole story, could you explain what happened? Or explain how that worked?
Why the pulsatilla worked for her?
No, just the concept of why the homeopathic remedies, yeah, why the pulsatilla worked in general, the homeopathic remedies in general were able to reach her where the antibiotics, and I'm not saying anything bad about antibiotics, It
Oh, they
just
have their
wasn't plugged in.
place. Both sides have their place, and that's the bottom line. Absolutely. Working with the antibiotic was prescribed to suppress her symptoms, to suppress her fever, to suppress the pain, to alleviate the inflammation. That's what it's for. But it didn't stop the why she kept getting these ear infections and why it kept coming back and what was the chronicity? Was it a time of year? Was it weather? Was it pollen? Was it stress? Was it all of these things matter? So for your daughter, this all right. There are over 9,000 different remedies in homeopathy right now, probably more at this point, with all the things that are being proven and created as remedies. The goal with homeopathy is like cures like. Your daughter's symptom picture, whether it was high fever, mercurial when she was sick, up and down, mentally and emotionally. Yeah.
Changeable, very changeable. Yeah.
Right. Either very weepy and clingy or leave me alone. Um, Fevers kind of coming and going,
Yeah, the
a lot of
symptoms were not,
mucus.
yeah, exactly. Exactly.
Right. Red in the face when she's cranky. Um, that's a pulsatilla picture. That's her symptom picture. That's also the picture that the remedy pulsatilla, which is made from a flower, the wind flower, it's a wonderful remedy, especially for children, adults too, very much so adults too, but very classically prescribed to children. Does her symptom picture match the remedy picture of pulsatilla? And that's the goal as a homeopath, is to collect a full symptom picture of what's going on, time of day, sensation of pain, quality of pain, um, when what when did it start? Do you wake with? Do you sleep into it? What makes it better? Pressure against the ear. What makes it worse? Loud noises or cold with a pulsatilla baby. So a bath that goes cold, that little one's going to lose her mind. Um, but something warm would be comforting for a pulsatilla child. So all of these things, if going outside into the cold makes it worse or better, or it doesn't affect her at all, if sleeping if is something that was waking her up at night or not. um is she more hungry? Is she more thirsty? Does she have a stomach ache with it? There's a lot going through the system at that time, and it's a whole system response. Are there any headaches? Is there any pain in the teeth? How's the throat? How's her tummy? How's her bowels? um is there anything coming out on the skin? All of those things. And the mental emotionals, which is pulsatilla, can be really strong. They're either weepy and clinging to you, or they're throwing their brother across the room. It's one or the other. It's a pulsatilla baby. They're dodgy. They're very smart too. And they're lovely. um but she matched that remedy picture. So when you gave it to her, and then you were looking at dosing and potency, I find that the lower potencies tend to have more of a material response within a client. We can shift test numbers with the lower potencies, I found in my practice. 30C is a standard acute potency to give, especially a child. If you look at the remedies, how to work with homeopathy, the starter books, let's say start with a 30C, or 6. 200, you get more into the physical and emotionals together, not so much just the physicals as a 30C tends to be. Technically, well,
Let's talk about what C means. What does C mean?
there's different scales of creating potencies. There's a C scale, centennis, there's an M scale, there's different
LM
scales.
scale?
And I'm not the one asked to describe
Yeah,
that, because I get all
I guess what
balled
I'm
up on
headed
that one.
for is the pulsatilla that I gave my daughter, and there's belladonna, and there's arsenic, and there's all this. there's not any molecules in the remedy. It's the vibrational essence that's in the remedy. And the vibrational essence, I think I've always understood it as being measured by the 30C, the 6C, or the 200C, that was the measurement of the vibrational um, impact of that
Right.
energy. So there's no pulsatilla molecules in the
Mhm.
remedy. It's the
No,
energy essence.
right. Below Avogadro's number is a way to put it. Um, a lot is being talked about was it Emoto, the Japanese scientist, and is the
Yeah,
water.
right.
A lot of that
Yeah,
research that he did, and I've got the book right there, and I can't I'm trying to get his name right. Um, that explains homeopathy very well and how it works. The memory of water, and that he proved a while ago, and actually he got shushed for that one, but it's come back around lately, which is a beautiful thing. That and the microdosing that everyone's doing and the memory of water is very much what we've been saying all along with homeopathy, because that's what it's about. It's the
yeah,
energy, the essence of the remedy in the water, put onto little sugar pellets to take under the tongue. Um, and that's how it goes.
yeah, yeah. That's now this homeopathy is about 250, almost 300 years old. The practice of
I
it.
think it's 275 now, something
Yeah,
along that line.
because I remember it was the big Samuel Hahnemann
Hahnemann,
developed it through, and he discovered it through treating a malaria child with Sakona bark.
right?
And he realized that the Sakona bark, if you chew it, causes these symptoms that look like
Malaria,
malaria.
correct.
So he started to do that, and then he started to realize that the less of the element that you had of the Sakona bark, the better his patients were. So he kept breaking it down until it was an energy essence. I don't know how he figured that out. That was amazing.
Oh, he was brilliant. And he was a medical doctor at the time, and he just could not abide by what they were doing in the practices, the bloodletting and all that. He just was like, no,
That's all wrong. Yeah,
this
you're
is not right.
now he did that and he took off, and what made him, I thought, famous was Napoleon's march, his army. He treated his army for quite a while. He was with, was that him in, or was it one of his doctors? Well, anyway, he treated the soldiers for whatever ailed them, and they started to do well. Do you remember that story?
Don't remember that being Hahnemann, but that doesn't mean it's not correct.
Yeah. In any event, he started to his discipline, him and his discipline started to prove homeopathy as being very effective. And you told me some really amazing facts about the Spanish flu. Um, when that outbreak was in the 1900s, right? Early 1900s. Now, homeopathy had been around for quite a while. Um, and I have a list of where it is right now. But anyway, the patients being treated by regular Western medicine or regular medicine, and the patients that were treated by homeopathy had very different results. What were those results?
I wish I had the numbers in front of me right now. I would have
Well, not
grabbed those.
specifically, but it's like nobody died that was taking the homeopathy
Right,
remedies, pretty much.
right. That was the bottom line. It was like 2%. It was ridiculous. Because at that point, there were homeopathic hospitals and homeopathic doctors in the homeopathic hospitals. So that, and then they had the allopathic doctors over here in their allopathic hospitals. So they had the different places to work that out. And the difference was
Yeah.
phenomenal.
And there's a hospital in Worcester called the Samuel Hahnemann Hospital. It's all allopathic now. There's no homeopathy, which is ironic. But so that's a little like, okay, just feel that's a marker of. Do you remember when we used to do that? Because America, his foundation was with homeopathy for quite a while, and it
Yes.
shifted allopathic. I don't know if that was a political shift or.
That was a Rockefeller move. Yes.
Rockefeller. Thank you, Mr. Rockefeller.
Mhm.
So,
Yeah.
why would he do that? Do you,
Um, well, that's a whole rabbit's hole to go down.
well,
And
did he
that's
did he not want homeopathy around because he thought it was a non-effective treatment, or did he not want homeopathic around because he could make money elsewhere?
the second one,
Yeah, because I kind of
very much so.
yeah.
And actually, if you practice, he created the AMA, and if you practiced homeopathy in any way, even if your wife practiced homeopathy at all, you lost your license, took it away. So
So why?
people had they had to survive. They had
Yeah.
to put food on the table.
Around that time, I'll just tell you my personal story. My great grandmother and her husband came from Germany. They came from the Black Forest of Germany, and
Oh wow.
homeopathy was big there.
Yeah.
And she was a midwife, and her mother had trained her, and her mother, grandmother trained her mother, and and it was so many generations of women. So she came to this country with her husband, who's a brewmeister, and thinking that they were gonna start to. There's a lot of religious, political stuff going on. It's like, well, America's got to be better. So she brought her midwifery skills and never said what they were. Um, and she got shut down by the AMA when and they didn't even know what she was doing. She came to New York in Hell's Kitchen where there was no money. People were giving you chickens to deliver their babies, kind of thing, or
Yeah.
and so it was very poor. And she had a lot of success with cures, and her name got out there. And there was this young girl. His family they were across the railroad tracks where they had money, and he paid her to help her work with her daughter who had the sleeping sickness. They called it, it's malaria, and she treated her, and she was cured. Not just I'm okay now, she was cured. And so her name got out and she became famous. And so as a result, the AMA, the guys in the suits came and knocked on her door and said if she were to do that again, that she would be shut down. She threatened the well-being of her family, and she stopped training after many generations of midwives. She stopped training her daughters, and that was one of her daughter's biggest sadnesses, is because my Aunt Tilly wanted to be a midwife so bad.
Wow.
And
That is so sad.
yeah, yeah, they were very poor. They were lucky to finish school because my grandmother was sent into the factories when Aunt Tilly was her sister to work in those, how they lock the doors in those New York factories, and what happened there. So one of the pillars of the community was shut down. And that's one of the reasons why I've been so fascinated with homeopathy, because I'm like, how did she cure that little girl with sleeping sickness? And I feel like I bet you it was homeopathy. I
I
would,
was like,
because in any event, why I want to talk about this is because there is this intelligent, incredible modality that speaks to the whole person, and you do it, and you did a fantastic job of it. So I'm talking too much. You should be talking more than me. I did some fact searching, and the World Health Organization, we all respect them for the, pretty much estimates that homeopathy is used by 500 million people worldwide, making it the second most widely used medicine in the world. It's in
yes.
England, France, Germany, and the Netherlands. Homeopathy is included in the National Health Service in those countries. In France, 18,000 physicians prescribe homeopathic remedies. There are 7 medical schools offering postgrad degrees in homeopathy. 23,000 pharmacies carry homeopathy remedies.
So
42% of the
beautiful.
British physicians refer patients to homeopaths. The royal family has used homeopathy for 3 generations, and there are currently 5 homeopathic hospitals, and the oldest, the Royal London Homeopathic Hospital, has been there for 100 years. And India has over 70,000 board certified homeopathic physicians, hundreds of homeopathic hospitals and clinics, and many homeopathic medical schools. In Germany, 20% of the physicians prescribe homeopathic remedies. In the Netherlands, 45% of the physicians consider homeopathic to be effective. And it's also practiced in Vienna, Scotland, New Zealand, Australia, Canada, Russia, Brazil, Argentina, Mexico, Pakistan, Greece, and Belgium.
South Africa.
South Africa. I bet you could name even more. I just did a quick, you know.
Mm-hmm.
I mean, I think that's amazing, and my opinion is that America lost out on an
Well,
incredible
hopefully
medicine.
we're
Yeah,
swinging back,
I hope so. I hope
but
so.
we're standing strong as homeopaths, and the amount of homeopaths that are becoming certified is growing. And when I started my practice about 12 years ago now, 10, 12 years ago,
Yeah,
people had no idea what that word meant. Um, but now more so,
yeah,
you say like arnica. Everybody knows arnica.
yeah.
Arnica's in everything. It's good. It's increasing. It's comfortable, and my practice is full. I have everything from newborn babies that their mamas bring in. Their
Nice,
moms came here when they were pregnant. And now we've got the little ones. One of my favorites is a 101-year-old who I sit with on Tuesday mornings. Oh, she's amazing. Um, she's just a gift.
nice.
Men, women, teenagers, it's the whole gamut because there's not, I mean, there's always a percentage of people that you just can't help for different reasons. And usually that's because you truly don't have the whole story. You truly don't have all the symptoms, all the mental and the emotional and the
Right,
physical symptoms.
right.
And there are people that don't respond to homeopathic remedies. There is that too. They just don't respond to them. And that's just how it goes. And you just got to let that be. Um, but to sit down, you know, people will come in and I'll say, well, why are we here? What do you need? And we'll start with, we'll start with like migraine symptoms, or it's my stomach, or it's grief, or it's depression, um, or it's a kid that just can't sit still to save his soul, um, which they shouldn't. They're kids. They're not supposed to have to sit still all day. It doesn't make sense to me. Anyway, um, and we'll start with, okay, let's talk about the migraines. And it's the specificity of the symptoms that matters the most.
Mhm.
So just to say, I want to talk about migraines, that's a blanket. And my next response is, where does it start? Well, it starts here. And then what happens? How do you know it's going to start? What's the trigger symptom that's saying, oh, shoot, I'm getting a migraine? Um, and a left eye twitch. There's so many odd things that happen. But when you start talking with somebody about their symptoms, they get it. I mean, they know these things are happening, but they haven't looked at them in this way. And that's how homeopathy goes. It starts here. It feels like someone's hammering on my head. And then it goes down to the back here on that ridge, that occipital ridge, and it feels like pressure. And it's hot if I touch it. And then it comes up here and it comes around to my eye. And it feels like I want cold on it. I put
Right.
cold on it, or I don't want light, or the pressure feels good, or the pressure doesn't feel good, or it makes me angry, makes me want to have people
Yeah.
around me, but I don't want to talk to anybody. I want that comfort, but go away. Um, Makes me nauseous. I mean, all the more specific we can get, the closer I can see what remedy picture, which we talked about in the pulsatilla, where those symptoms of that migraine match that remedy that has those same symptoms. And my job is to match the symptom picture with the remedy picture.
Right.
So we get very specific on what the symptoms are and how it goes.
It
Time of
takes
day
time.
is a big idea. Weather is a big
Weather. Yeah.
game changer with migraines.
Yeah.
Um, Full moon, new moon, There's so many things that come up and they all matter. They all matter. They're all in the repertory. It's surprising the strange symptoms someone will say. And I know it's in the repertory because I've read it. I'm like, oh my God, there's that symptom that I thought I would never see.
Yeah.
There it is.
Yeah.
That is awesome.
I'll tell a story about just trying to explain this symptom thing. When I was studying and student, I had different people that I worked with, and this one woman in particular who didn't really believe anything I was doing, but she said, "Oh, all right." So she was feeling poorly in this certain area. Now she's expecting me to get a remedy to solve this identified disposition, this identified problem. I can't remember exactly what it was, but I watched her. I took the case, but I also watched her, and she went into this, that whole list, and then right in the middle of it, she went off on her husband and how she just went up one side of him and down the other, and I looked that up as part of one of the symptoms that was showing it. And when you look up do a case, you're looking at you have a materia medica, you have this book, giant book of symptoms, and you just look up all the different symptoms and then you see which remedies. Well, I found a remedy that was matching everything, but the thing that brought it home is her going up one side, her husband down the other. It was really nasty. It was the nastiness that brought the remedy home. So I treated her with the remedy, thinking, I don't know. She took one dose, and I'll tell you, she did. Nobody knew this, but she had a cyst on her ovary, and it burst, and it it healed itself. And she goes, "Well, I guess I didn't need that remedy anyway." So it was, it was, it was like, it was like it took care of itself. And I'm like, and to me,
Yeah,
it
let
was like
that
a
go.
miracle. It's like this remedy told her body how to heal itself, and I feel like that's what these remedies do. Because they're not taking over the situation, they're reminding your body how to heal itself. Is it?
Right. It's like that picture of dropping the pebble in the water and all the ripples come out. The remedy's goal is to restore the person to their best health. That is the goal. Physical, mental, and emotional, just like you said, spiritual also. That's the goal.
Yeah.
Matching up those pictures.
So many times we've been given treatments, allopathic treatments, which the symptoms go away and whatever will heal, but that sense of well-being doesn't come back. That's But in homeopathy, I've watched that sense of well-being come back. That woman whose cyst burst, who was so calm and peaceful the next day. It was lovely, and she didn't rat on her husband for quite a while after that.
Time for another dose.
Yeah.
Yeah.
But that was what homeopathy is not. It's not herbal remedies.
No.
Let's talk a little bit about that.
Um, oh, homeopathy. The remedies are put on, I'll put some in my hand. They're put on most usually sugar pellets, but sometimes they're put on milk, sucrose. And can we see these?
Tiny.
Little tiny little pellets.
Yeah. Oh, yeah, you can see that. And what she's doing is she's holding up these pellets that just fit between her fingertips. Just
Right. And these are large ones actually.
yeah.
Um, and you put them under your tongue to dissolve. Like when people do nitroglycerin and they put it under their tongue, you just put it under your tongue, let it dissolve. No food, brushing of teeth, water's okay for 10 minutes either side so that the mouth is a clean palate. Um, and that's how you take them. And kids love them because they're on sugar. So, there's no response to them.
And the whole point of the remedies is that it's not suppressing or taking over. Like an aspirin disappears the headache for a little bit, but doesn't solve why the headache is there. It actually it's working with your body's ability to heal itself.
Right. Right. The body's innate ability to know what to do. And I spend all day down PubMed. I research the hell out of things. This is a science.
You're amazing. You do.
it's if I don't know what I'm talking about, if I don't understand what someone's symptoms are telling me is going on here, which is why the A&P 1 and 2 and the pathophysiology being the progress of disease. If I don't understand that I'm looking at a liver situation here, or I'm looking at a heart situation here, then I should not be doing this. So I'm research, medications that are being taken. What are the side effects of those medications? Is that part of the symptom picture this person's saying to me? To which I will bring that back to the client and say, you're taking this medicine here, and that's a choice because it's for X, Y, or Z. And I'm just want you to understand that what you're looking at here, this symptom may very well be a side effect of what you're choosing to take allopathically. Just so we know, let's take this out of the picture because that's not part of you. That's a response to a medication you're taking.
I
So
know.
there's a lot of that too. Trauma responses, car accidents, people that pass on that's traumatic, falling out of a
Well,
tree, getting a
the la-
divorce, all these things are hits.
Yeah.
And I work with clients that have cancer and I work with the symptoms of cancer. I need to be very specific on that. And I have had more than one client that been working with who can tell me from an emotional hit in their life exactly when that manifested in their bodies. And they know to the day, this happened that day, and I knew something was very wrong with my body. And can anyone say specifically they were right? No, but there's been a lot of research on that
Yeah.
also that can be found if you look it up. And I've seen that in my office repeatedly. And that's a trauma hit. Never well sense, like you talked about, never well sense being sick. Never well sense is a big deal homeopathically. Um, and that's a very important piece of it too, to track back. I send a timeline to clients so I understand, why are we here?
Mhm.
Why are we here? We're not just all of a sudden here. Why are we here? What's happened in your life? Because it all manifests to why we're here at this moment, and going back through all of that. There's a lot to it. We're not chewing sticks over here. Mm-mm.
There's no, there's a lot to it, and you know what? I've seen people who layers. You talk about never well since, but there may be three or four never well since that are layered inside of each other like nesting dolls. And I have watched people being treated where one layer is lifted, then there's another layer, annoying another layer that's lifted, and then they get to the core of who they really are. And that's the whole point, is getting to the core of your essence, who you really are, and they blossom. And it's especially this person who's been particularly sensitive, like those sensitive phosphorus people. But even well, that's this type of essence a person could be. But as you uncover the person's, take these layers off, and you let them shine, then you change their lives. I've seen lives changed, which is really exciting.
Yeah,
But it's
me
work.
too.
It's work.
Right. It's not easy.
But it's
And
it's
I have great respect for naturopaths. And I that was kind of a silly thing to say about chewing sticks. I apologize for that. It's naturopaths and work is beautiful. So forgive me.
there's so many modalities. There's so many
Mhm.
modalities, and I'm sure there could be a time when a homeopathic remedy, it's just you're stuck in it, and then you go, do acupuncture, or you go, or suddenly you get an infection that needs a special fast treatment. I don't know. You know better than I do, but I feel that coming back to homeopathy for get through what you got to get through, but keep coming back to homeopathy would is a really healthy thing to do in your throughout your life.
Oh, I agree. I will suggest Reiki. I'll suggest chiropractic. I'll suggest cranial sacral manipulation. Um, there's a lot of things to support. There's a lot of really cool things going on in energy work too that has benefit. I mean, the whole things, and I don't care which one makes this person that's sitting in front of me better. All together at once. It's not, there's not one way. It's a
Exactly.
big picture. And there's a lot we've all been exposed to as human beings here at this point that we have to clear. There's so many times where I know that this client is this remedy and it just is, and that remedy won't touch the person. And then I'll have to go back and clear things out of their system to get back and drop that remedy in and have it just go.
Yeah.
And it's beautiful.
Yeah. Oh, yeah. It hits it right. You know it hits it right because the person has a smile on their face, or they're talking a different story. He's like, oh, it's getting there.
Mhm.
Yeah. Yeah.
Yeah.
Like watching that my little baby girl, she'd start to get crabby, she'd start to do certain things, and I knew that ear infection's getting ready to pop.
Yeah.
And
And it
isn't that
must have been
interesting?
less and less.
Yeah. So I mean, it's just interesting to me that mental emotional thing is such a big part of homeopathy that is exciting because the person is healed. The person is healed. Their essence is real to them.
Right. Right. I always like to have someone coming in the first time come to the office. We'll do Zoom, we'll do phone and all that. The first time to sit in someone's energy completely and ask questions about what's your anger and what makes you happy and what makes you sad and what do you do with grief, and watch the body language, watch the eye contact, watch the hands moving, is the feet tapping, can this person look at me when they talk about anger or grief, or are they looking somewhere else? Is there, is this tappity tap going on and getting a stone face? I mean, weeping, anger, a lot of tears come up when you talk because you're just tapping on doors with love and kindness, and just opening them up and seeing what's inside and letting stuff come out. So tears are a wonderful discharge. So there's tissues everywhere in this office. When you sit with people, and just because you're with them for at least an hour minimum on a focused consult, 2 hours for a full consult, that's plenty of time to just gently, with love, tap on these mental, emotional doors and let them come forth with what they need to talk about. They've a lot of the stuff they've never spoken to anybody about or verbalize it to anybody. And they're surprised that they're saying these things that they had forgotten about or just had never brought up to anybody. And I'm writing my notes. Um, I don't have a computer in front of me or a phone going, everything shut off. I take notes by hand because then I'm looking at the client and not at my keyboards. That's that's not appropriate to me. I'm there with this person. So that's important to be seen and heard.
Now, let me ask you this: if somebody's really interested in following through on homeopathy, how can they research and find a homeopathist in their area, and what would they look for in terms of getting you're a certified classical homeopathist? How, you know what I'm saying? Let's get somebody. Don't get. I had my friend help me, which was wonderful and lovely, but you need a professional. Where do you look?
Yeah. If you go to the National Center for Homeopathy, NCH, they have a list. You can go to find a homeopath. You can go to your state and get a whole list of certified homeopaths in your state. And that's the easiest way to do that. Then you can find them anywhere. Um, I'm not accepting any new clients at this point. My practice is full, and I'm deeply grateful about that. And that was a very, very hard decision to make. Um, but I continue to support my clients who are current and any family members or friends that they want to send over, of course, and that will maintain. But I also have a list of homeopaths who are local to the area that I'm in, Massachusetts, New Hampshire area, to refer to if they want a recommendation to someone that I know personally that I can send off to.
Beautiful. And you can find Susan on Susan's Homeopathy on Facebook. I suppose they could message you, and if they couldn't find somebody, and you've got yeah, that would be the best place to find you, I think. And
Yeah, or Susan at Susan's Homeopathy is my email.
okay,
If we need an email, it's an easy one.
thanks. So
Lots
lots
of
of
letters.
lots of resources here to try it. And if somebody wants to read up on it, what do you recommend? What books or YouTubes or
Um, that's a big question. If someone's looking for a book to be able to use, like a house book, Asa Hershoff has a wonderful house book that I like a lot. Miranda Castro has some lovely books for the house that are wonderful. Um, those are the two I recommend the most. Because depending on how you want to look at something, they're they're easy enough to understand. Someone that isn't looking at it from a homeopathic mind yet. And the beginning intro explains a lot of things about potency and dosage and all that kind of stuff. So when you get there, you're like, okay, I get this. So those are the two for off the cuff, easy wood. Miranda Castro's book, Castro, or Asa Hershoff, Hershoff. Both great house starter books.
wonderful, wonderful.
Yeah.
Yeah, yeah. I know I have a huge library that I'll pick up and go. I don't know what's going on right now. They're packed in boxes still. I have my library's not out, but I love going through those books. I love going through the materia medicas, like looking at symptoms. It's
Yeah.
like, and then seeing all the remedies next to the symptoms is really interesting. Anyway, I've always come up with some really great first aid, quick things. Bad flu sting, coughs, colds. When it sticks, what the snot coming out of your nose.
Allie
When
Bick.
Cali Bick, when it's
Mhm.
Cali Bick, that kind of thing. So those are all real simple, easy, acute things to do that you really can't hurt yourself with, or misconstrue anything like. So that's kind of a fun place. I thought I started, but
Yeah. On Whole Foods, some of them are carrying them, some of them are not anymore. Hopefully that's reversed. Um, Amazon, you can get them on Amazon, of course. Um, they're not hard to get. And they're the tubes,
yeah.
they're $9 and they last you forever. I
Oh
mean,
my
it's
God,
cheap
yeah.
money to pick up a remedy. It really is. They're good. And if anyone's got any questions, send them over.
Definitely, definitely.
Yeah.
Yeah. So Susan at Susan's Homeopathy, get a hold of her
Yeah.
and she'll say whatever she's gonna say. She'll put you in the good direction. I know she.
I got you.
Yeah, yeah. Well, energy healing. You could say homeopathy is a form of energy healing before energy healing was a coined phrase. But
Absolutely.
yeah. But it's I don't know that any remedies can actually hurt you. I know they have the concept of proving a remedy. You can take too much of one remedy and you'll start feeling the feeling it, but
Showing symptoms of the remedy.
yeah,
Right. But you really have to go overboard for that. Um, it's not that you're having bad symptoms from the remedy. I mean, you can, but that's just bad prescribing. Um, a lot of what comes out is the symptoms that you want your body to release. You're letting it go.
yeah,
So a
okay,
lot of that. So people will say, I've got this rash. What the heck? Say, okay, have you had this rash before? Oh, yeah. I had it 6 years ago when this happened. Well, that's called a return of old symptoms. And that's a good sign that the remedy's getting in there and it's tossing symptoms out. So that's the first thing to look at. Have you had this before? Is it a return of old symptoms? Um,
and
is this
it's a returnable symptom, but as the remedy works it out, the rash will go away. It's
right?
it's burning it off in a sense. Uh,
Right. And it'll last maybe 2, 3 days. And on a severity factor, 0 to 10, they tend to be somewhere like a 3, 4,
Mild.
and once you know what it is, it's like, all right, so this is a good thing. Yes, this is a good thing. You may get a fever as your immune system's responding to a remedy. That leave a fever be. That's your immune system doing its best work. Let the fever run. That's all right. You may have more a mucosal discharge. Your body's discharging. You may have more of a bowel discharge. Again, your body's discharging. It's getting rid of things. All of these are good. And you just keep in touch with who you're working with, saying, this is happening. Got it. This is all part of your notes. This is all part of seeing how a client responds to a remedy and what's going to happen. And we learn the remedy response, the sensitivity of a client, and how it's going to go. And that's part of learning how to work with remedies. Just like with any other medication that you take for the first time, allopathic, you're not sure how you're going to respond. It's the same thing with remedies, but in a gentler way, because you stop the remedy and it stops.
Now,
Okay, hold.
yeah, you stop the remedy, it stops. But I also is in it. You take the remedy, and then when you start feeling better, you stop taking the remedy, right? And then
Right.
if it returns, then you'll take the remedy again. But you're not taking the remedy to keep things away. You explain that a little bit, because I did remember getting kind of can I just give her pulsatilla every day and that'll work? She said, no, you only give it to her when she has the symptoms.
Right. It's as needed,
Okay.
as needed. And that's why we're talking about the trigger symptom with the migraine. How do you know you're going to get a migraine? How do you know this is possibly coming back?
Yeah.
Oh, that thing is happening. All right, let's take a dose.
Okay. Okay. All
Yeah,
right. It's just a beautiful. It's complicated, but it's very simple and direct.
it's both.
Yeah.
Yeah, exactly.
Yeah. Yeah. Anything else you want to add to people's understanding of?
Um, I think we're good.
It's
I
very.
also part of my practice is working as a shamanic practitioner and a Reiki master. Those are the
Oh,
spiritual side of the practice. Those I am taking new clients with. Um, so I've got the whole realm covered: physical, mental, emotional, and spiritual.
spiritual. Yeah.
So grateful for this lifetime for this. Deeply grateful.
Yeah, I've done
Mm.
both with you. I've done the homeopathy. Then we get to a point, then we say, okay, there's a deep releasement that needs to happen. Then we'll do the shamanic journeying, and then some more amazing things will pop up. But I wouldn't have been able to do that shamanic journey if I hadn't prepared for it, working up to that point. So it's a terrific combination of things. I'm just giving you my recommendation for everybody.
Thank you.
But
Yeah, I won't work shamanically with someone if they have a lot of physical pain. No, we're going to work homeopathically first if the person chooses and bring down the pain so that the spiritual healing has more room.
to
That matters.
yeah, 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 yeah. Very satisfying practice. You must be exhausted, but you must also have some sense of I'm helping people. You're seeing people really
Ryan,
move forward.
working on it.
Yeah, yeah. Well,
Yeah,
there's a lot of peoples out there that are hurting, and it feels like an endless thing. But people
find a homeopath.
they've done really well
Be
with your.
gentle to yourself.
Yeah, yeah.
Yeah.
Beautiful. So I want to recommend to everybody who finds this interesting or is curious about it to do some research to understand the difference between homeopathic is one remedy at a time, and it's understanding the nature of what's going on. It's not a throw a bunch of herbs at it and see what happens. And I love herbal remedies and I use them all the time. Um, and nor is it a suppressive thing. It's a really recognizing who you are. It's a very patient, give it time, and the first thing in the closet is the last thing to come out. So sometimes you got to just keep taking those layers off to get that last thing, that old shoe. That's oh yeah, this is. But you kept throwing
Oh,
things on top of it.
suppressed rage. Shocking. Come on, let's go.
Exactly, exactly. So, and then do take advantage of Susan's generous offer of reaching out to her, ask her questions, and then the National Center of Homeopathy (NCH) is that
Yep.
is a good place to find references. and read up on it and be curious. Again, this is a proven modality of over 250 years, 275 years, and it's the second most widely used medicine in the world. So
Right.
be
And one of the
curious.
arguments is there's no studies, and there's studies all over PubMed about homeopathic remedies. So
Yeah.
that is not true.
One of the biggest studies is Napoleon's soldiers. I'm not going to go that far into what they were studying for that, but they sure did change things. and
Mhm.
uh, and he was able to keep marching because that homeopath fixed up his soldiers, and and on it goes. The Spanish flu and so many other things. Unfortunately, we had that turn in America where the other countries did not have those kinds of turns. They did not have those kinds of pressures. So they were actually able to go hand in hand with or right next to side by side to allopathic and naturopathic. And I'd love to see a resurgence of homeopathy in this country, but people need to know about it, need to understand how it works. And so I'm so grateful, Susan, that you come on and we talk about it um, and kind of educate. Here's this really cool thing that's right in your backyard. You can grab hold of it and feel good and change a lot of stuff. And so
And
thank
my
you.
apologies for being excited about talking about it. And once I get going, I'm just
Oh,
so
gosh.
forgive me. This is passion for me.
Well, we want more of that. That's what we want here. And something to be excited about in terms of making yourself, getting better, really feeling better, coming back to that essence of who you are. Takes a little help sometimes. So,
Yeah,
yeah,
we're
so,
humans
yeah,
in these
exactly.
messy bodies. There's a lot going on.
I know, it's formidable human bodies. And so, anyway, to people who are listening, please use this as your inspiration to research this modality that's tried and true. It's proven, and it's very old, and it harkens back to when Hippocrates says, "Like cures like," and so can't go wrong with that. And
Mhm.
some of the things that we're being treated with now in the allopathic world are so brand new that nobody really knows what they do or what the ramifications are. And I'm not going to poo poo anything because there's major medical breakthroughs, constantly over the past years. It's just that homeopathy is something that is fundamentally beautiful and gentle and respects the human body and the human process. So it's worth taking a look at. So,
Absolutely.
so I don't. So anyway, if you have any questions, you just also can contact me, Nancy at angelscapes.net, or on my Facebook. You could message me and say, "What were you talking about?" And I will be happy to talk to you more about it and send you in the right direction. Susan is one of my closest friends, so I can find you for her if you want.
He
And
knows where I am.
yeah, so reach out, don't be shy, and live well. This is the end of the session. This is all we have to offer right now. Hopefully Susan will come back and offer some more. But for now, I want you to, really look towards being healthy, feeling good, knowing who you are at your essence, and look to your spirit. It's worth uncovering, and stay safe and be happy. Find some joy in your life. And so for now, be well, and we'll see you next time around.
Thank you for joining the Angelscapes podcast. We hope you've gained new insights and inspiration for your journey to uncover and access your soul's power. For more information and a deeper dive into finding clarity in your life, go to angelscapes.com. Remember to subscribe so you can be part of the discussion. It may just change your life. See you next time.